I was raised in Webster Parish in near Minden, and I graduated from high school from Sibley High School in 1998. Went on to college at LSU in Shreveport, where I got a degree in biochemistry. Graduated from college in 2002, and then went straight on to medical school. Went to LSU in Shreveport for medical school, where I graduated in 2006, and then stayed in Shreveport for residency, which I completed in 2010. I was in private practice for about 8 years in Minden, and then decided I was going to try something different. Went on to hospital medicine in Tyler, Texas, where I worked for about a year and realized how much I missed the aspects of private practice. So I actually came back to Minden kind of in a hybrid model, and have just realized again how much I miss that developing that patient relationship of private practice. I'm an OB-GYN. I did a local program called Area Health Education Centers Program, or AHEC, when I was in high school. I was actually a freshman in high school, and we rotated through the various parts of the hospital, and OB was probably one of my favorites. It was where I first experienced childbirth. I had never attended a childbirth before and thought it was the most miraculous thing I had ever seen. I wasn't sure at that point what I would end up doing long term, but as I made my rotations through medical school, luckily OB was my last rotation, because once I reached that point, I knew 100% that that was what was for me. My practice is a general practice. I am very comfortable dealing with adolescent gynecology as well as low risk and high risk pregnancies. But I also enjoy the surgical aspect of it. I would say my perfect day would involve a couple hours in clinic, a delivery, and a surgery. I mean, that would be my ideal day, because it encompasses all the things I love about OB-GYN. I believe my patient treatment philosophy is that my diagnostic abilities begin with my initial encounter with the patient, be that in the hallway as the patient is being escorted to the exam room, or the moment I walk into the exam room. I think you can learn so much about your patients, not just from what they say or their physical exam, but their demeanor and how they interact with other individuals. So I think it's important that you walk into the exam room beginning to collect data, and getting to know your patients on those other levels. I also think that no patient should leave an exam or a clinic visit or even the OR surgery with questions. So you'll very frequently hear me say, any questions, comments, concerns, anything I can do for you today, as my last statement to the patient. I get satisfaction in my job by putting patients' fears at rest. A lot of my day is spent reassuring patients, making sure that they know something's normal or not normal, but either way, reassuring them that if it's not normal, we will get to the bottom of it together and hopefully fix the problem. But if it is normal, just giving that peace of mind that it's nothing they need to worry about. When ladies come to see their OB-GYN, we know that it's usually not something they look forward to, because it's just an uncomfortable situation. But my hope and my goal would be that as women come to know me and begin to become comfortable with me, that they look forward to the visit, just as like seeing an old friend.